Hey folks, Cherry here for Sedona Surgical. So just coming by because I was asked in one of the comments on a previous video if I could do a small video on keloids. So what can I tell you about keloids? Some people keloid, some people don't. There's no real way to know if you're going to keloid other than maybe if you've had keloids happen in your past when it comes to getting a cut, getting burned, or dealing with some type of scarring or even incisions from previous surgeries. That's really going to be the only way to know if you could potentially have a chance to keloid. Now, if you are aware that you keloid, and that's one of your fears when it comes to having plastic surgery, because you're going to be dealing with incisions and scarring not only during the procedure but afterwards, right? And you don't want to stay with some type of scar that's ugly. You just have to let us know. Typically, if you speak to your surgeon and you let your surgeon know that you suffer from keloid or from hypertrophic scarring, set up where you can get a steroid injection both during surgery and shortly after surgery so that your skin can minimize the amount of keloiding that happens during your healing process. Now, typically it varies between patients, but it does typically run 1 to 3 injections, usually 2 to 3 injections. Like I said, 1 is during surgery and then 2 usually during your post-op time frame. And then again, there's other ways to manage your scarring. So there's always things that you can do to lighten your scars and to work with your scars. Silicone is one of my favorite products when it comes to working with scars because it re-infuses your scar tissue with lots of hydration. It makes sure that your tissues are hydrated, soft, flexible, and again, minimizing scarring and dark tissues. You know that you suffer from keloids, hypertrophic scarring, or have had issues with scarring in the past, just let us know. I mean, it's as simple as that. Remember that this process is not a one-size-fits-all, although some of the procedures seem to be very common. Each and every one of you deserve specific and personalized attention, and that is what we'll give you. So make sure that if you have something going on, you let us know so we can address it. Otherwise, can't do anything for you, can't help you. But I hope I answered your questions. If you need anything else, comment below.